Dante. I'm Katie.
Hi, nice to meet you.
Nice to meet you. I am the social work intern here at ERC, and part of the assessment process is I'm going to ask you some questions, but first I kind of want to just check in on you and see how you're doing, because I know the first day can be kind of overwhelming.
Yeah, it's just a lot to take in and process. There's so many things to remember to do, and it's just meeting a lot of people.
Yeah, it is a lot of people, because you're meeting a therapist and your dietitian and the nurse, and it's a lot to remember, but don't worry about it. You will get the hang of it, and it'll get easier as it goes on, I promise.
Okay.
Okay? Now, do you mind if you take a few minutes to answer this questionnaire with me?
Oh, okay.
It's called the Patient Stress Questionnaire, and it's part of a process that we do with all of our patients when we first come in, and it kind of assesses a few different domains. So it looks at issues with depression, issues with anxiety, potential issues with trauma, and substance abuse. Okay? So all of the questions are asked a little bit differently, and I will explain each one as we go on. Okay?
Okay.
So this first set of questions,
How long is it?
it's really quick.
Okay.
Let's see. It's front and back, 2 pages. There's 9 questions on the depression, 7 questions on the anxiety scale, 4 questions on the trauma scale, and 10 questions on the alcohol scale, but they tend to go pretty quickly.
Okay.
Still feel good to doing it right now?
Yeah. Okay.
Okay.
I'll try.
Okay. So these questions are for the last 2 weeks. How often have you been bothered by any of the following? Little interest or pleasure in doing things. Not at all. Several days. More than half of the days. Or nearly every day.
Several days.
Several days? Okay. Feeling down, depressed, or hopeless. Not at all. Several days. More than half of the days. Or nearly every day.
More than half.
More than half? Okay. Trouble falling or staying asleep, or sleeping too much.
Oh.
Both of those?
Oh.
Or trouble falling asleep or staying asleep? Nearly every day?
Yes.
Okay. Sleeping too much?
No.
No? Okay. So just trouble falling asleep and staying asleep.
Mhm.
Okay. Feeling tired or having little energy.
What's the one before all the days?
More than half the days? More than half? Okay. Poor appetite or overeating?
Well, I don't really have an appetite, so no appetite.
So nearly every day or more than half of the days?
Nearly every day.
Okay. Feeling bad about yourself or that you are a failure or have let yourself or your family down? Not at all. Several days, more than half of the days, nearly every day.
More than half.
More than half. Trouble concentrating on things such as reading the newspaper or watching television?
Several.
Several?
Yes.
Okay. Moving or speaking so slowly that people have noticed, or being so fidgety or restless that you've been moving around a lot more than usual? Either of those?
I feel like people don't really notice anything, so none of those.
Okay, so not at all. Okay. Thoughts that you would be better off dead or hurting yourself in some way?
Several.
Several days? Okay. Just want to remind you that there's absolutely no judgments here. Like, this is just to kind of get like a baseline of where you were at, and also to let us know like things that we can work on with your therapist and your team.
Okay.
Okay?
It's just kind of nerve-wracking to answer.
Absolutely, for sure.
Okay.
Is it something that you just don't talk about very often?
No, I haven't talked about it at all.
Yeah. Okay. So it's definitely something that you can talk about further with your therapist and any of us too, if you feel like you want to go into that.
Okay.
Okay?
Thank you.
You're welcome. Okay, so these next set of questions are answered the same way. Not at all several days, more than half the days, or nearly every day. And again, for the last 2 weeks.
Okay.
Okay? So, feeling nervous, anxious, or on edge?
Several.
Several days. Okay. Not being able to stop or control worrying?
More than half.
More than half. Okay. Worrying too much about different things?
Several.
Several. Trouble relaxing?
More than half.
More than half. Okay. Being so restless that it is hard to sit still?
Not really.
So not at all? Okay. Becoming easily annoyed or irritable?
More than half.
More than half. Feeling afraid as if something awful might happen?
Maybe several.
Several? Okay.
No, more. What's the one before several?
Before is not at all. So not at all, several days, more than half the days, or nearly every day?
Several's okay.
Several. Okay. Alright, so these next set of questions are just yes and no, and they're regards to some trauma. Are you currently in any physical pain?
No.
So in your life, have you ever had any experience that was so frightening, horrible, or upsetting that in the past month you have had nightmares about it or thought about it when you did not want to?
Yes.
Okay. Tried hard not to think about it or went out of your way to avoid situations that reminded you of it?
Yes.
Were consistently on guard, watchful, or easily startled?
Yes.
Okay. Felt numb or detached from others, activities, or your surroundings?
Yes.
Okay. Okay. Now these next set of questions are about alcohol use and how they can affect your health.
Oh, I thought you were going to ask the specifics about the trauma.
Right now we're just trying to see indicators of trauma, and then your therapist will go more into detail with you. Since I'm the social work intern, I'm just taking the assessments today.
Okay.
But absolutely, your therapist will probably be interested in going over some of the things, and then of course you are more than welcome to also bring it up with your therapist.
Okay.
Okay?
That feels better.
Yeah.
Okay.
Okay. But thank you for asking that question. Okay, so these set of questions are about your usual drinking habits. We've listed the serving size for one drink below. Oh, that's helpful. Okay, so how often do you have one drink containing alcohol? Never, monthly or less, 2 to 4 times a month, 2 to 3 times a week, or 4+ times per week?
2 to 3 times a week.
2 to 3 times a week? Okay. How many drinks containing alcohol do you have on a typical day when you are drinking? 1 or 2, 3 or 4, 5 or 6, 7 to 9, or 10 or more?
10 or more.
Okay. How often do you have 4 or more drinks on one occasion? Never, less than monthly, weekly, daily, or almost daily?
Was there a weekly?
Weekly. How often during the last year have you found that you were not able to stop drinking once you started? Never, less than monthly, weekly, daily, or almost daily?
Monthly.
Monthly, okay. Failed to do what was normally expected from you because you were drinking? Never, less than monthly, weekly, daily, or almost daily?
Almost daily.
Almost daily, okay. Needed a first drink in the morning to get yourself going after heavy drinking? Never, less than monthly, weekly, daily, or almost daily?
Weekly.
Okay. Had a feeling of guilt or remorse after drinking.
Every time.
Daily or almost daily?
Almost daily.
Okay. Been unable to remember what happened the night before because you had been drinking. Never, less than monthly, weekly, daily, or almost daily.
I typically remember. So.
Okay. So never or less than monthly?
Less than monthly.
Less than monthly? Okay. Have you or someone else been injured as a result of your drinking? No. Yes, but not in the last year. Yes, during the last year.
Yes, during last year.
Yes, during the last year. Okay. Has a relative, friend, doctor, or other health worker been concerned about your drinking or suggested you cut down? No. Yes, but not in the last year. Yes, during the last year.
Yes, during the last year.
Okay. Okay. So now I'm going to score these, and I'll kind of explain to you how the scoring of each one of them work, because they work a little bit differently.
Okay.
Okay. So again, these are just kind of like an assessment place to see where you're at and where we can go from here.
Mm-hmm.
So for the first part, the depression one, a score you scored 15, and that is an indication of moderately severe depression.
Okay.
So depression could be an issue for you right now. Have you been diagnosed with depression before?
I haven't really seen a therapist at all.
Okay. All right. Then that's definitely something that will be like good for your therapist to know. You scored lower on the anxiety scale, so it may be a potential risk for you having anxiety, but it may not be. You did score anything answered yes in the trauma may indicate some trauma history. It kind of sounded like that was the case for you. And then any score of a 9 or more, or 8 or more in the last category is an indication of potential substance use. So that might also be an area for you and your therapist to work for.
Okay.
So, do you have any questions?
Is anybody else going to see this?
So your therapist is going to see this, and probably as well as Dr. James, our psychiatrist, and then also probably Dr. Moore, who is our medical doctor here.
Oh, okay.
So those are the people that will see this.
Okay.
So they kind of use it again, like the same way that your therapist will, as like information to better help you and better assist you while you're here.
Okay. Okay. What if I don't want to work on some of those?
That would be something for you and your therapist to kind of touch on. At the PHP level, you only get so much time, so there's definitely probably not so much work done in like deep trauma work. But our main goal is to get you back on track with your meal plan and to develop some solid coping skills. But if your therapist and your team decide at a certain time that, for example, if your trauma is just like very prevalent, they can try and get like a different therapist for you or something like that.
Okay.
But that would again be for you and your team to discuss.
Okay. So then I should have a meeting with them next too? Okay.
Yep, you'll have a meeting with them today.
Okay. All right. Thank you.
Deep breath. Well, thank you so much for your time.
Thank you.
And we're late for